And throughout your career, you spent a lot of time in clinical informatics, and you'd mentioned building masters and PhD programs, and kind of from there to the real world of enterprise implementations. How do you think we're doing as an industry, kind of educating and producing the talent that we need in these critical areas to move forward?
Yeah, that's a great question. I mean, it, I think that what is fascinating is the big explosion that is occurring around technology and data is happening in a very strange way. So just to give you some basics is I believe the last calculation I'd read within the last few years is we're putting out in the United States less than 15% of our college graduates are graduating in what we would term STEM fields, with a decent understanding of math and science and data and technology, which is not going to be enough, right? That's not enough humanity in these key areas to do a lot of what we need. And so we are also, so we're and then we are retiring out, the baby boomers are retiring, and the baby boomers had a much significantly higher rate of STEM education. So we are truly, as a country, but this is actually international. We're beginning to see this as an international trend. We are losing STEM at the time period where the people that are in STEM are blowing up the world, right? I mean,
Mhm.
think about what's happening in Silicon Valley and all these other places. Is that so? That's the first part. Is that the talent just in the field is not there. It's hard to find data scientists, uh,
Yeah.
if not impossible. And so that is, right now, if you're a report writer, I think a lot of people in healthcare think that you do magic, right? Just being able to produce good quality
Yeah.
reports out of it. Doing true analytics is really, something reserved. As I said, there are a lot of industries that put a lot of money. I think maybe that's the point that I'm trying to get at. It's really an investment. It's an investment that hasn't happened yet.
Mhm.
We've invested in the tool to collect the data. So I would say now it's impossible to walk into a successful hospital or hospital system and not have it be substantially drenched with technology, with data
Yeah.
technology. Whether we're leveraging all of those tools, I think, is really the key issue. And my question would be, how can you leverage it when you don't have any data scientists there to do something with? So either we have to create a world where we can do the data science in the computer, again, creating the black box again, but you actually can get your insights and bring them into a presentable manner to people who don't inherently have that skill set themselves. Or we have to
Right.
begin to think about training people within organizations as good users of data. And either of those scenarios takes money and time and effort. So
Yeah.
how
That makes
how are we doing? We're not. I think specifically in healthcare, it's really challenging to get good data that is meaningful because we usually are understaffed, and the work we're usually understaffed because both the investment hasn't been made in it, and when you do decide to use data in a sophisticated way, now you're out competing with every other industry in the world to get those resources.
Yeah, and I think there's some going back to the AI opportunities. I think there's definitely some opportunities within AI, and a lot of the initial disruption is going to be ironically within the engineering and technology space. Right, there's so much that can be done right now with again that kind of co-pilot use case on data discovery, and kind of being able to fill in the even some of the subject matter expertise gaps that we see for technologists entering into the field of healthcare. I can tell for myself. I mean, 15 years ago, I came in as a Silicon Valley engineer into healthcare, thinking like, how hard can this be, right? And it was really quick. Where a lot of people end up just kind of putting their hands up and saying, I'm going back to something that's a little bit makes more sense. But I think that the industry is obviously big enough. The problem is big enough that you're seeing a lot of really great technologists dig in, stay focused on healthcare. So I think it's a really exciting time, but the shortage is absolutely there, and something we need to really keep our eye on as we think about making sure that healthcare organizations have access to the talent that they need, both clinically and on the technology side.
Well, I'll
Um,
give you a little one tidbit too that I think it's very strange how the Silicon Valleys and other, you know, other entrepreneurs have gone about developing tools for healthcare. Because I think that there was it was bad investments up front. When I first became a CMIO, I remember reading, I think it was 85 to 90% of all startups in healthcare IT failed within a year. And I
mhm.
think that that's not uncommon. I've heard that about restaurant, starting restaurants and things like that too. But you would talk to these people and they didn't have a physician or an informaticist or somebody. It was a bunch of people behind a computer trying to decide what they could do around healthcare. And I think we still have some of that. I would say if there
Yeah,
was more collaboration in, let's be really creative, getting the right set of physicians and nurses to design what will be helpful, right? Because what I was noticing is that you'd have a great idea that didn't fit into any workflow, right? You're like, wow,
mhm.
you're doing a lot of sophisticated calculations and a lot of interesting use of data, and it will never in the world translate to what we do over here because it was unplugged from the practicing clinician. So I think that that's the
Yeah,
thing too, is that I think the collaborations and investment around this, again, let's let's get in there, get our hands dirty, and figure out what is the ways that
yeah.
we can take a system and make it better that's actually useful for everybody.